Okay, so we have a 7-year-old female. We are going to perform decap BTLS, starting with her face. We're observing her face and her eyes. We're going to examine her pupils with the pen light. Pupils are dilating. We're going to check for drainage or blood in the nose, in the mouth. We're going to check for any deformities, any foul odor. We're going to check the ears for any drainage or blood. Now we're going to perform decap BTLS in the head, checking for crepitus, deformities or injuries, bruising. We're going to go down to the cygomas, the maxilla, the mandible. Still checking for tenderness, depressions, or deformities. Now we're going to perform decap BTLS in the neck. We're checking the jugular veins, checking for distension, checking that the trachea is in place. We're palpating the front and the back of the neck. We're also going to check behind the ears for any vital signs. Now we're going to move back down to the chest. We're going to check that the chest, that breathing rate is normal. We're going to palpate the ribs. Now we're going to move down to perform decap BTLS on the abdomen. We're checking for rigidity or tenderness. We're palpating the abdomen. We're going to compress the pelvis on both sides. We're also checking for any signs of injury, crepitus, bruising. Now we're going to move to the iliac crest. We're going to press down, checking for the same thing. We're going to grab the stethoscope and we're going to check for anterior breath sounds in the axillary and mid-clavicular areas. Now we're going to perform decap BTLS in the extremities, checking for crepitus, bruising, any deformities, injuries. Take the pulse rate. We're going to move to the next arm, do the same thing, checking pulse rate. Move down to the legs, checking for the same thing, crepitus, deformities, injuries, bruising. We check the pulse rate at the feet, check the other leg, do the pulse rate again. Now we're going to move back. We're going to move to the posterior side of the body. We're going to gently and securely roll the patient over, while securing C-spine. On the count of 3, 1, 2, 3. We're listening to breath sounds in the back, at the base and the apices of the body. We're also going to check for any signs of injury or crepitus or bruising. At the same time, we're checking for buff for signs of blood or bodily fluids. And this completes the assessment.